In this video, I'll be giving myself a Gonal-F injection. It's a subcutaneous injection used as a fertility medication, generally in conjunction with IUIs or IVF cycles. Gonal-F and Follistim both generally use this pen form nowadays, so if you're using Follistim, this should apply for that too. So if you take the pen cap off, you can see that this vial is actually filled with the FSH medication. It's a 900 IU vial. And then at the bottom of the pen, you'll see that there are dosage amounts that goes all the way from 37.5 all the way up to 450. So even at the highest dose, you'll be able to get two uses out of one pen, and actually at that highest dose. So that's what I'll be doing in this video today. So the first thing you'll do when you're using a pen for the first time is open up an alcohol swab and clean off the threaded part at the top of the needle. Then you'll take, when you get your pen, you'll get a pack of little needles like this. Sorry about that. And you'll take one of the needles, you'll open up the top, you can kind of see the bottom of the needle there, and you'll screw it on. You can feel when it's on correctly. You need to make sure it's good and tight there, because some people sometimes have injection problems. So once it's on there, you pull off the cap, and you'll see there's still a little protective cap there. So the reason why you're doing this first-time pen prep is to make sure that if there's any air bubbles in the vial, you can just kind of shake them out. So here we are at that 37.5, the lowest dose you can be at. And what you want to do is kind of tap the vial a couple of times. So if there are air bubbles in it, they'll shake to the top. And then you pull out the pen as far as it'll go, the bottom, and now inject it. And you'll see, you might be able to see there's a couple of little drops coming out the top of the needle. So that pretty much assures any air bubbles in the vial to come out. And now you want to put the little inner protective top back on the needle, and be careful you don't stick yourself. And now you can prep the pen for your actual dose. You want to actually dial up your dosage, which, as I said, for me is 450. So I'm going to spin it until the arrow matches up with 450. And then you want to pull out the bottom until you see the little 450 next to your dosage. So it'll come out pretty far. So you can see right here that the arrow is over at 450, and that you can also see the little red lettering at 450 there. So now what I want to do is actually do the injection. The needle itself might look a little scary, but it's actually really thin and really sharp, and you don't even feel it going in. So first what I'm going to do is swab the spot with a little bit of alcohol, so that actually dries up the pores and makes it a little less sensitive. And then I'm going to pinch a little bit. It's about 2 inches to the left and to the bottom of my belly button. And then you just want to kind of put it in a quick dart motion. So it's in there. It doesn't hurt at all. Usually let go so that it doesn't squeeze out afterwards. And then you want to get the medication in, and you want to click. You want to hear as many clicks as 37.5 doses there are. So for me, it would actually be 12 clicks. So okay, and then once it's all in there, you want to just leave it in there for about 5 seconds so nothing drips out of the needle, and then just pull it out quick. Sometimes you'll have just a little spot, a speck of blood come out, and if you have any gauze, you can just wipe it off. But usually with me, I have nothing or just a speck, and then it's no big deal. So, and then once you've done that, you want to put the main cap back on the needle, unscrew the needle, and then they usually give you a sharps container, or they should give you a sharps container that then you can dispose of in. And that's all done. So what I'm going to do is stick the pen cap back on, and then refrigerate the rest of it so that I could use the rest of this pen tomorrow for my next dose. Hope that helps.